Right. Hi guys, Dr. Castro here from Arete Chiropractic. Today I'm doing the collaborative business series with Dr. Rinita Trahan from Harbor Eyecare. Hi Rinita.
Hi, Lisa.
So why don't we start up with you introducing a little bit about yourself, what got you into optometry?
So I'm an optometrist at Harbor Eyecare Center, which is located in downtown Portsmouth. So I provide like primary eye care as well as some specialty contact lenses and things. Dr. Sarah Hudson provides primary eye care, and then I also work with Dr. Amy Krusensky, who provides traumatic brain injury and a lot of neuro care as well. I particularly got interested in optometry because myself as a kid, I hadn't realized that I needed glasses for years before I actually ended up with them. So what was happening was I would be, like trying to see the board, I'd be squinting, straining, and I thought that that was just normal because most kids don't know what normal really should be. Um, and so it was a couple of years in, and I had passed all the vision screenings and everything because I was always a hard worker and I wanted to pass every test. So, and it was hard because they would do them, in front of other kids. And so it was a little awkward. So then what would happen is, so basically a teacher, and I was 10 years old, she realized that it seemed to be straining. So then she kind of recommended that I get an eye exam. And obviously, from there on, it kind of worked out for me. So I'm grateful for the experience, and it turned out all right.
Yes, it did.
How about you, Louisa?
Well, kind of like a similar story. Well, with the eyes, I just got my glasses with you 30 years later, after I was like, Dr. Renita, I really need glasses because my eyes are getting tired after work. So I'm loving those guys. But what got me into chiropractic was I was living in New York, and chiropractic, I'm from Brazil, and chiropractic's not really a thing in Brazil. So when I moved to New York, I got introduced to chiropractic, and I was doing marketing as a career back then. And then my chiropractor really changed the way I saw health from more from like an inside out perspective than rather than taking medicine and kind of like taking care of diseases and more optimal function. How can you be as healthy as you can? And you kind of um, I got really into it with the philosophy of inside out health and all that. So I decided to just quit my job in New York and then drive to South Carolina to go to chiropractic school. And I don't look back because it has changed my life, and I am a lot healthier than I ever was, and it's great.
That's amazing. The importance of preventative medicine and just truly taking care of your body for the long run, not just waiting for something to break, is
Yes,
important.
especially right now, people are starting to realize that it's not about managing your high blood pressure, your diabetes, about preventing those things from happening, right? And preventing getting your immune system really good and your health really good, so you can take care of yourself better. But speaking about the pandemic, so what are you seeing in your practice since we had those changes from working at home, kids not going to school, and all those things?
Yeah, so this is a huge change for everybody. Something that I've seen over the last couple of years in general is a lot more computer vision strain for adults and children. So just being on a computer for extended amounts of time really tests our focusing system and our ability to cross and kind of keep our eyes focused for reading. So whenever we look at a screen, what we do is we cross our eyes and the lens inside our eye flexes and changes shape to let us see that point clearly. So after, let's say, 20, 30 minutes of doing that, the system might start to get a little bit tired. So either it does two things. Either it will just let things get blurry, double, and then you are forced to look away and refocus, or you kick it into overdrive and you really, really focus hard to keep yourself going, but it's not conscious. So after hours of working on a screen, not taking many breaks, some people start to notice like headaches or just fatigue. They'll get sleepy. So it's something that's starting to pick up a lot more. Prior to this happening too, for children, we were seeing a lot more of that as well because they're on up close devices like tablets and phones so much more than there used to be. And then on top of that, they're working hard at school, and now for them, school's on the computer. So as far as like emergency visits that I've been seeing the last couple of weeks, a lot of them are for children who are suddenly getting headaches, kids who didn't have headaches prior. So we've been doing a lot of binocular testing to try to figure out, is it the vision or could it be posture or something else? So for a handful of kids, we've been recommending to take visual breaks as well as using like blue light filtering lenses. Do you have any comments on posture?
Yeah, for sure. So what you're saying about the headaches and muscle tension, we're seeing a lot of patients that are not really having good ergonomics at home because they don't have like a proper desk. Most of them don't have a proper desk, or they're doing work from the couch or a kitchen table, which is not the best when you're there for 8 hours to 10 hours a day, right? So people are kind of like hunching more into the computer because most of the times they have their, home laptop or not a proper computer where they don't have the eye level, which is huge for you, right? The screen should be at your eye level, so you're not looking down or up and you're not bringing the shoulders forward. So it's not only creating the vision, which creates headaches and muscle tension, it's also creating a lot of like bad posture because they're in this position for a long time. And then kids too, because the kids are used to, going to school and doing sports and moving a lot. And now they're sitting doing Zoom calls all day long in a computer, which is not really good for their health, right? So I'm seeing that I need to adjust patients a lot more often than I used to before because they're getting more tension in the body. And also mental health, if you're stressed, right, your body kind of holds it in a compensation, right? So a lot of people hold stress in the shoulders or lower back. So I'm seeing a lot more tension because of stress as well as bad ergonomics too.
Yeah, and that's something that you guys have helped me with significantly for my own back is what you said, which is that I hold stress in that upper back, and all of this like hunching at a computer, definitely not helping anything. Um,
Yeah. And also with you, I learned that, when I'm teaching patients like exercises for the neck and upper back, and then I kind of added the one you told me that,
yeah,
when you look at the computer after 20 minutes, you kind of look at something else, and focus on other things so you don't keep your eyes looking at one thing for a long time. So I started adding that too, which is great. And patients are like loving it because, neck and eyes are super related.
of course.
Yeah.
Yeah. So that 20-20-20 rule is what we call it. So every 20 minutes, look away for 20 seconds at a distance like 20 feet or further. And so I tell people, I'm like, basically just every 20, 30 minutes, just reset for a moment, look away, take a sip of water, stretch your upper back, just, like breathe deeply for a moment. It takes moments, it takes 20 seconds, and then you can go back to what you're doing. My issue is just remembering to do it because it's easy to get really focused.
Yeah.
So what I do is on my web browser on Chrome, you can add extensions. So like one is called like the Pomodoro clock, and it sets like a 25-minute timer. So for 25 minutes, it blocks all my distraction websites so I can just focus. And then it also is that reminder of, okay, now I should take a proper break and just, get up for a moment.
Mm-hmm. Yeah. I tell patients like put a timer on your phone. Like, those, for example, my watch tells me to stand up every hour, right? So that's when you see that thing beeping, that's when you not only stand up, that's when you do your I 20-20-20, and also your, open up the chest, bring the neck back, and do some preventative. That way, people are more productive because people, they think that if they take a break, they're going to lose work, right? Because they have to keep working, keep working. But there's a ton of research that shows that if you take proper breaks, you prevent fatigue. And fatigue is the number one of loss of productivity, right? So taking proper breaks will not, losing a minute or 5 minutes out of your day, it's not going to hurt your productivity, and you can actually be healthier and you produce more when you're feeling good, right?
So I have a question. So as far as things relating to the new normal now, what types of things in your practice have you guys made changes to?
Yeah, so we basically stayed open throughout the whole thing. Of course, like we're seeing about 50% less of our capacity, so we don't have a lot of patients in the office at once. So we have three providers here, so we're basically seeing one patient, so there's no one in the waiting room waiting, and we're also having people wait in the car, and then we're wearing masks, and then also cleaning, so the tables, the machine, everything, we're cleaning after every patient, taking temperature of the staff every day. We actually did the whole staff did a COVID test, so the antibody test, and everyone was negative. um, so we're doing everything we can, and also like, because you're a patient, after getting adjusted, we have people rest in the recovery room. So we have also people resting in their car, so laying the seat back, and they just, it's sunny outside, it's so gorgeous, and you can just like stay outside. If this was winter time, it would be different because you don't want to wait in your car when it's cold or rest in your car. But right now is working great. So yeah, we're doing everything we can, and then we also have, so for patients that are a high risk or have any family members that are high risk, we have a special population time. So they can call in the office and say like, hey, I'm at high risk. So we don't have anyone else in the office when they come in. So we kind of block it out. That way, even I'm not, if, for example, if I'm seeing a high risk patient, Dr. Vivian and Dr. Evans will not see other patients, so there's only one person in the office. So it's been working out so far. I mean, it's a lot more work. My arms are getting just from wiping the tables a lot. But it's new changes, and change sometimes is hard, but you got to do what you got to do, right? But what are you guys doing?
Yeah, so we've definitely made some pretty good changes as well. We're also trying to limit how many people are in the offices once. So on a staff side of things, we're doing a team one, team two approach. So there will be half as many staff in the office at once. So we just do half the week for one team, half for the other team. And then on top of that, we're spacing out patients with longer appointment times. What we do is we have a patient wait in their car and give us a call when they're here. That way we can do as much of, answering questions, preparing for the visit, starting to take, medical history questions, understanding what's bringing somebody in, just to limit time in the office. And then we will meet somebody at the door. We'll open up the door, take their temperature, make sure they have a mask. And then as we move through the office, every single room as a whole is cleaned. So basically, anytime a person enters, we will then make sure that we sanitize that room immediately afterwards. And then in our optical, we're also scheduling time with them, which previously the optical was not by appointment only, it is now. And the reason for that is we want to make sure that each person can get some quality time. And then the optician will then clean, sanitize every frame that gets touched, anything that anyone's interacting with. So we're trying to keep things as contactless as possible. And then on top of that, just really making sure that people know that their time is just for them.
Mm-hmm.
Customer
Yeah.
care.
And I know that in the beginning, you guys were only seeing emergency cases, and right now
Yeah.
you're starting to open up more appointments.
Yeah, and definitely any emergencies that do happen. So what someone would do is still call our line, and we do have the option for a telehealth visit. So most things we do need to see the eye in person, but there are some things where if somebody is unsure, we can do a video conference with them, and that's another way to have an exam as well.
That's really good. Yeah, and I know that we co-manage patients all the time, so I kind of know how important the eyes to for myself, because I was having, headaches and problems with fatigue. Looking at the computer doing reports was really bothering my eyes, and it's been a huge change. And I know that, the work that you do is essential, and I'm glad that you're able to go back in there and provide services to the community, right? Because it's all about getting back to the health that we want.
Yeah, and I have so many patients where it's interesting how closely connected the eyes and the brain and the neck are. But I will do everything that I can possible, and it's not until they see you and start getting their brain and their body to start talking and communicating that they can actually make progress. So there's so many patients of myself and Dr. Amy doing a lot of traumatic brain injury work. Your role is truly essential to that. We wouldn't have been able to make progress for so many patients without it.
Yeah, I think it's a two-way street, right? No one has one perfect answer, but if we can get a good team together, then patients can get better faster, right? And that's what it's all about. Yeah, so that was great to talk with you, Dr. Renita. And I hope I see you soon. I know we haven't seen each other in a long time.
I do think I have an appointment coming up, so at least we have
That
that.
is true. That is true.
So
All
much, Dr.
right. Good to see you, Renita. Take care, and I hope to see you soon. Okay. Bye
Bye.
bye.